Why does eating less sometimes cause stomach pain? Eating less may cause the stomach to keep producing acid with less food to buffer it, whilst reduced fibre intake can slow gut transit, causing bloating and cramping. Are you cutting calories to manage your weight, but finding your stomach is making life uncomfortable? You're not alone. And there are some important things worth knowing. Stomach discomfort is one of the more common but less talked about experiences when you reduce your food intake. Understanding what's happening in your body and when to take symptoms seriously can make a real difference. When you eat less than your body is used to, your digestive system has to adjust. One of the first things that can happen is a change in gastric acid. Your stomach may keep producing acid even when there's less food to digest. That can lead to a gnawing or burning feeling in your upper abdomen, especially between meals. It can feel a bit like hunger pain, and in a sense, that's exactly what it is. Another common issue is a drop in dietary fibre. When we cut calories, we often cut out foods that were quietly keeping our digestion moving. Less fibre means slower gut transit, which can cause bloating, cramping, and constipation. The NHS recommends that adults aim for around 30 grams of fibre a day, so it's worth thinking about whether your reduced calorie diet is still hitting that target. There's also a hormonal side to this. During calorie restriction, levels of ghrelin, sometimes called the hunger hormone, and cortisol can rise. Research suggests these hormonal shifts may contribute to uncomfortable stomach contractions. So some of what you're feeling isn't just in your head, it's a genuine physiological response. If you're taking weight loss medicines, it's worth knowing that these can independently cause gastrointestinal side effects. This includes orlistat, GLP-1 medicines like semaglutide, sold as Wegovy, and dual GIP GLP-1 agonists like tirzepatide, sold as Mounjaro. If you're experiencing symptoms and you're on one of these medicines, speak to your prescriber about what you're noticing. You can also report suspected medicine side effects via the MHRA Yellow Card scheme. So what can you actually do about this? A few things are worth discussing with your doctor or a registered dietitian. How quickly you've reduced your calories matters. The NHS recommends a gradual deficit rather than a sudden steep cut. Very low calorie diets, generally defined as below 800 calories a day, should only ever be followed under direct medical supervision. If you're currently doing something more restrictive than that without professional support, that's a conversation worth having with your GP. It's also worth looking at the quality of what you're eating, not just the quantity. Keeping fibre intake up, staying well hydrated, and not skipping meals entirely can all help reduce digestive discomfort. Now, this is really important. Not all stomach pain during a calorie deficit is just your body adjusting. There are certain symptoms that should never be put down to dieting alone. Please contact your GP promptly or seek urgent care if needed if you experience difficulty swallowing, blood in your stools, unintentional weight loss beyond what you'd expect from your diet, or pain that is severe or getting noticeably worse. These are red flag symptoms that need proper assessment. Don't wait and hope they pass. To bring this together, a calorie deficit can cause genuine digestive symptoms, including acid discomfort, bloating, cramping, and changes in bowel habit. These are often linked to changes in gastric acid, fibre intake, and hormones. Gradual, well-supported calorie reduction is safer and generally easier on your digestive system than drastic cuts. And certain symptoms, particularly severe pain, blood in stools, or difficulty swallowing, always warrant a prompt GP appointment, regardless of whether you're dieting. If this has been helpful, drop a comment below, especially if you've experienced this yourself or have questions you'd like us to cover. Give this video a like if it was useful, and subscribe to Bolt Pharmacy for more evidence-based health content. As always, nothing here replaces personalised advice from your own healthcare professional. They know your full picture, and they're the right person to guide you.